Pelvic organ prolapse can affect multiple areas of your life. It can prevent you from doing activities that you enjoy, like jumping or running. It can affect your sexual life, causing pain and discomfort and just making you feel subconscious. You might not be able to wear your favorite clothes or those white jeans that you always like to wear in the summer. And also, it might require you to take more time off from work to use the bathroom or just deal with the symptoms of pelvic organ prolapse. Unfortunately, women discover pelvic organ prolapse on their own, and they don't really know how common it is. And when they talk to their relatives, they basically get information that it's something normal and somebody else had that. The truth is, you don't really need to live with that. Even if it happened, it doesn't mean that it should stay that way. There are multiple treatment options that can help manage the symptoms and also they treat the anatomical prolapse on itself. So you don't need to suffer with any discomfort. What is a pelvic organ prolapse? It's also sometimes referred to POP for short. It occurs when the muscles and ligaments that supports the organs in our pelvis, like bladder, bowel, and uterus, become weak and can't hold the organs in the proper position. Pelvic organ prolapse is very common. About 3 million women in the United States can experience symptoms of pelvic organ prolapse. And also, 1 in 4 women who deliver their baby vaginally will develop pelvic organ prolapse at some point in their life. So this condition is very common, but unfortunately, this condition is very isolating because women don't really know about the pelvic organ prolapse. And when it happened to them, they feel that it's only happened to them and no one else. But again, you're not alone if you're going through this condition. There are multiple women suffering with the same issue. So what can cause pelvic organ prolapse? There are certain factors, modifiable and non-modifiable. Non-modifiable factors is your genetic. You can change your genes, and the same way how some women have a lot of wrinkles by the age of 70 and some have none. Similar with the pelvic organ prolapse. If you have stretchy connective tissue, if your mom or your grandmother had a pelvic organ prolapse, you're at a higher risk of developing this condition. Also, pregnancy or childbirth. Pregnancy on its own increases risk of developing pelvic floor disorders because of increased weight and pressure in your stomach. And the vaginal birth is one of the major risk factors to develop pelvic organ prolapse because when the baby goes through the birthing canal, it creates a lot of stretching, micro trauma to the muscles, to the ligaments. And sometimes those traumas do not heal properly and tend to cause issues later on. You also can't change the fact that we all age and menopause. As we get older, our tissue is becoming weaker, is not the same. And also, as our hormones declining, the risk for developing pelvic organ prolapse increases tremendously. There are some modifiable factors. For example, having pelvic surgery. Any surgery done on your pelvic floor and your stomach can impact and can increase the risk of developing the condition. Being overweight, especially having essential obesity, will increase the risk of pelvic organ prolapse. Chronic conditions like chronic cough or constipation is contributing factors to POP. And why is that? It's because every time you increase your abdominal pressure, that pressure pushing on your pelvic floor, it will increase the likelihood of developing pelvic organ prolapse. What are the symptoms of pelvic organ prolapse? There could be some pelvic discomfort, some vaginal pressure, feeling of fullness, or sometimes some women describe it feeling like they're sitting on a marble. Sometimes back pain can be a presenting factor, discomfort with sexual activity, And also, the interesting thing is that all the symptoms get worse at the end of the day. I would like to talk about some myths that are very common in a pelvic health. For example, that Kegels will solve all your issues.
Well, Publilius, you certainly can't pretend once you give birth, because you get super loose.
That's only if you don't do Kegels.
That's not true. And Kegels are not good for everyone.
You're doing your Kegels, aren't you?
So if you're someone who has a very tight pelvic floor to the point where it's not functioning properly, which is quite common, doing more Kegels is actually going to make your condition worse. So it's very important to get evaluated by urogynecologist or pelvic floor physical therapist to assess your pelvic floor to determine if Kegels are right for you. Another common myth is that having pelvic organ prolapse is a normal part of aging and you should just live with that. Not true. Even though pelvic organ prolapse is more common as we age, you don't really need to suffer with that. You can always get it fixed to improve your quality of life. And another common myth is that nothing can be done to fix pelvic organ prolapse. And it's not true. There are multiple options that are available, ranging from conservative methods of changing your lifestyle to the surgeries that can fix your prolapse once and forever.